Hi, I'm Don Michelle, President and CEO of the Troy, Maryville, St. Jacob Marine Chamber of Commerce, and I am joined today drinking with Dawn. Stacy has one too, because we love our McDonald's in Troy. Stacy's here, and she's from Dr. Midkiff's office. I'm going to just start out by saying I've been going there for a very, very long time. Deanne is my girl. I'm just
Yeah,
saying, Deanne is my girl. She's my girl. I
I
love it.
understand.
Tell us about you and what you do.
So I am the newest practitioner here to the group. The last couple years I was at Barnes, mainly working on postpartum and the Women's Assessment Center, which is kind of like a women's ER, mainly seeing OB patients. But I was also trained in high risk OB. I've been here at Dr. Midkiff's office now for almost 7 months. So time has gone by really quickly.
Yeah,
And I've really, really enjoyed my time here so far.
very nice. Well, I have a couple questions for you, just because I think it's one of those things, the wellness women exam, who it's just not talked about. I'm not sure why. I'm not sure why it's not talked about, but that's why we're here today to talk about what it means, and the importance of them every year. Some of the concerns, preventive health care and birth control and perimenopausal and menopause. And I'm going to let you take it from there because this is out of my world. Although I've been through the menopause thing, you guys helped me through it. I made it. My sweating is gone, I will
Yeah.
say. But can you talk about those topics?
So, the Well Woman exam, I think it starts very, very early on. I have a lot of moms come in and say, "Hey, my daughter is 13 years old. When does she need to start coming in here?" And, I always say, especially if somebody is sexually active, they need to come in. But the earlier that we start to teach women about their bodies and how they can monitor things themselves so they can bring it to our attention, I think it's the better. It is starting that rapport early on and seeing women through, adolescence, through their early 20s into 30s and then beyond. But it is about the preventative care. It's always easier for us to take care of things beforehand rather than being reactive. So, a woman comes in and everything looks great, and then we kind of talk about how to do a self breast exam. And then 3 months later, oh my goodness, I found a lump. Well, it's a lot easier to do that than waiting for something to, be a huge mass or something 6 years from then, when if we would have caught it early, it would have had a better outcome. Also, just birth control with unintended pregnancies, having that conversation with our young adults, talking about how to prevent sexually transmitted infections and, the treatment for those. I just, getting a woman in here and building that rapport. You said, you've been coming here for years and years. You have that special
Mm-hmm.
relationship with your provider and you feel comfortable with her. And then that way it allows you to open up more easily to her about things that might not be going okay, like, hey, I'm in my mid 30s and I'm starting to have hot flashes. Like, what's going on? I don't feel that any woman should ever sit and suffer with symptoms that she's having. My cycles are irregular. I'm trying to get pregnant. I mean, it's all of the things. But then it even is for those women who are just like, you know what? Everything's going great. I still would like to have my yearly pap smear because we look at those cells just to make sure that we see just the slightest change in them, because that can prevent cervical cancer in the long run. It is getting women familiar with their bodies and having that rapport is what it comes down to. And it's always better to be, proactive rather than reactive with something. And I think that in women's health, a lot of times, I mean, personally, this has happened to me in the past of a doctor pushing their agenda on me. And that is that is not what it should be. We should be in charge of our healthcare and being that advocate for ourselves. But what I have found here in Dr. Midkiff's office is that we work well with our patients to come up with a mutual plan of care. So then that way both of us are happy with how the plan is going, and women feel empowered to take charge of their own healthcare.
And the best phone call I get every year is what?
That your pap smear is completely normal.
And I've had
Absolutely.
years where it wasn't, and guess what? I got a personal call to say,
Absolutely.
let's do this, let's do this, let's do this. So, just leading into my next question of how are you guys different from a personal point of view, I can tell you what I love, and I'll just use Deanna, is, hey, we're just watching this. I looked back 6 years and we did this. It might be time to do this. Or, hey, everything looks great. My favorite thing she does is, what kind of questions do you have for me? I can ask her anything and she will
Absolutely.
help. And I feel like every single individual in that office is doing that.
I would agree with you. And that's one thing that when I came here, that really was a part of my heart when I started talking to everybody, is we all come from the same thing. We want the same things for our patients. And if I'm not answering your questions, then I'm not being a good provider. And the personable approach that Dr. Midkiff has for all of us, that she doesn't want anybody to get news with a, if you don't hear from us,
No.
assume that it's good news. And it's just like, I never thought about how much of an impact that really is on our patients, but just to have that, no, we are going to talk to you and we are going to let you know that yes, everything's okay. But if it's not okay, we have a game plan to where we can get on top of this and do what we need to do for your safety and for your health. That is super important to everybody in this office.
And that is absolutely what sets you apart, because I really feel like you care about every single person that comes in. And I've always joked because I'm a customer service trainer, and I always say to Deanne, you're very present in here. I feel like I'm your only patient, and you've probably seen 100 this month, and yet before she comes in, she's looking at my chart. She's making sure that I don't have any questions. And but from a personal point of view, what inspired you to become a health nurse practitioner?
So I was diagnosed in my teens with endometriosis. So it is something that I have struggled with basically my entire life. And through that journey, through unsure if I would ever have children, to having my children, and then everything that comes along with being a young mom, and then endometriosis coming back and, rearing its ugly head. And I had so many people along the way, some fantastic and some that we're not really going to talk about today, but that they pushed their agenda on me and didn't sit and didn't listen. And at that point in time, I sat down and I said, you know what? I want to be the person that will sit down and listen. And it is, yes, we might need to come to a mutual agreement on something, but I always want my patients to feel heard. And I treat every single patient as they were a part of my family. And if I can't do that anymore, then I'm not going to do my job, because that's what I've had happen to me. And I want to be a difference for women moving forward.
That's fantastic. I wish there were more people out there like that and I think having the experience helps you realize how you felt, how you want people to feel, the importance of being present. But let's say it's our first visit with you, and maybe it's your first visit ever at a gynecologist. It has to be scary. Like, I can't even imagine, like, I'm 106, so it's been a long time since I had my first visit, but I can't imagine what it feels like. What do you guys do to help that situation?
So for me personally, because I don't go in with the other providers, but I sit down, especially with them young ones, and say, okay, just take a deep breath. We are going to get through this. And you ask any questions that you want to. And we will never, ever force you to do something that you do not want to do. Hands down. I know that from all of the other providers that we all feel the same about that. But then literally just taking it one step at a time. Do you want to see the equipment that we use during the exam? Do you want to see the different brushes? And literally, it is taking as much time as that young person needs or that older person needs. As you get older, things change. Sometimes people, it might be their 100th pap smear, but they still have the same fears from different experiences and everything. We will take as long as you need. I will explain everything that I do before I do it, so there's no surprises. And I think that that has really helped with new patients and older patients for us to be like, okay, we're a team in doing this.
Mm-hmm. It's how do you, you know, like I know you said 14 or 15. At what point do they come in? Their parents sign, I assume, something. At 16 they can come in by themselves. Is that what it is?
Actually, a patient at any point in time, they can come in by themselves. So once you walk into the OBGYN office, you kind of are in charge of your own care. So I make when girls have their moms come in with them or boyfriends, I say from the very beginning of the visit, I understand that mom's here now, but if at any point in time you want to talk to me privately, then that is your right to do so. And I will ask mom to step out. And that is because my relationship is with you. And, you know, we do want mom involved, but this is about you and your future health. Yeah.
Yeah, that's so good. That's, you know, it's so nice to know that when they come in, they have that option because, you know, it's an uncomfortable position. I don't need, you know, my mom, well, my mom
Absolutely.
probably want to come in with me. I'm going to tell her I got to stay on the wall. And if you know my mom, she's probably going to come in with me. What kind of, what, you know, what's new in the industry? What, I know you guys are up on like all the newest stuff. Tell us what's going on new in the industry.
So what we've been looking at most recently is different kinds of hormone replacement. That is like all of the rave these days. So just staying up to date on what our guidelines say for us to do and educating the not parents, I'm sorry, the patients about that, you know, because everybody has these different kind of thought processes about what hormone replacement was in the past, and we're kind of moving away from that. So we have been reading a lot of articles about, you know, different kinds of hormone replacement. What should we be looking for to put our patients at an increased risk for breast cancer, ovarian cancer, uterine cancer? So that is a big thing that we've been looking at a lot recently with the up and coming guidelines of how we should treat our patients.
And just to confirm, everything on the internet is not true.
1,000%.
Just telling you. And if they want the truth,
They need to come in and see
talk
us.
about it. I think women suffer lack of hormone replacement because they're embarrassed to come in or they're
Yes.
embarrassed to talk about it or they've heard horror stories.
Mm-hmm.
What, you know, is it an appointment they just need to make with you or how, what would you say is the next step?
The next step would just be to come in and get a consult with one of us. And we will talk about, we will, one, first and foremost, look at your history to see if you're a good candidate, because none of us here in the office are going to prescribe anything that would put you at an increased risk for anything. So we look through your history, kind of see what your symptoms are, and then prescribe according to those things. And most women, we are able to find them something hormonal, non-hormonal, that relieves their symptoms and makes them feel like a human again. Because let's be honest, menopause, perimenopause is not fun for anybody, but women do not have to suffer because there are things out there that can get you through it. And that is our main focus above all else, is let's get you feeling better, because then you feel like you're human and you can interact with society again without hot flashes and night sweats and all of those things.
Yeah. I can tell you that I know a lot of people that come there, and a couple have been very embarrassed about their sweating, and I was one of those a long time ago, but about their sweating, and I'm not
Mm-hmm.
sure that people realize an aspirin's not going to do it. You
No,
have to have someone do some testing to figure out what it is, and there are some great treatments out there that will
absolutely.
help you get through that horrible time. Men don't have to go through that, but I'm
No,
telling you, they have to suffer on the other end of us having menopause. I'm just going to
exactly.
say. Maybe we should have a class on that. Um,
Uh-huh.
but it's just one of those things. It's like the secret suffering, but you can see it in women, and they talk about it when you're with women. And I just want to say to them, just try something, but make it with a professional, and don't go on the internet and buy some product because it hasn't tested for you.
Absolutely.
You guys are there. How many babies do you think Dr. Midkiff has delivered in her life? Like,
20, yeah, she's been doing this for 26 years. I would not even be able to put a
me
number
either.
on it.
Me either.
Thousands of, and she is so excited recently because she's starting to see patients that she delivered
Yeah.
and that they are starting to deliver. And she gets so excited when they
Yeah.
come in. She's like, I delivered them. And I'm
That's
like, that
exciting.
is insane. Like, that is the ultimate, like, taking care of generations. And that is the best part about being in an office. At Barnes, it was very acute. I saw them and then they were gone and I didn't know what happened after that. But now I have that long-standing relationship with them, and it has been the best ever to start to form those relationships.
And in any business, a chamber business, any business, building relationships is important. But I think from a medical standpoint, it's even more important that you have professionals who care and who know what to do. Any final thoughts on our conversation? It's been fantastic. I've learned a ton, and
Well,
we're
thank
going to
you.
get this out to everyone, and they're going to learn. But any final comments?
I would just encourage women to find someone that they trust and that they can have conversations like we're having today with their provider, because there is nothing that you can say that is going to be embarrassing to us. It's not something that we've not seen, not heard about before. And there is no judgment. This is a no judgment area. And our main goal is to make you feel safe, to make you feel comfortable, and help you through whatever part of your journey that you're in. And that is, you can find that person out there. I would love for it to be here at our office, but ultimately is what the patient feels most comfortable with. And I am so excited to see how far my journey goes and to get to meet more and more people and to help them find their voice with their own healthcare.
Well, I can tell you, I was meeting with a couple of people from your office, and they're like, "You have to interview Stacey." I'm like, well, I'm on it. Let's interview Stacey. So we have a couple of quick questions at the end because this is how I roll. Because I mean, it's all professional, and now I got to know favorite
Okay.
pizza topping.
Pepperoni.
Do you have a favorite song
Favorite song.
or artist?
Artist. So it all depends on what kind of mood I'm in.
What I'm saying.
So I am a lover of 90s R&B. That is when I was like in high school, and I've got some great memories there. But as I've gotten older, I really love Rascal Flatts, and their favorite song of mine is I'm Moving On.
I'm
I
moving
think it
on.
talks about your journey through life, and I
Yep.
am I am moving on to bigger and better things.
That's awesome. Now, the next question is important. And if you haven't
Okay.
watched any Drinking with Dawn Expert, this one might throw you for a loop, but I'm hoping that you know the answer to this.
Okay.
See behind me. Do you know
Okay.
a Barry Manilow song?
A Barry Manilow song.
Please, please, Stacey, don't disappoint me. Please.
I know what he looks like.
Okay.
I mean, but
Can you not smile without him? Can you
can
be
I?
at the Copacabana? Ah,
I'm
Stacey.
so
Okay.
sorry.
We're going to send you the complete 5-hour CD disc. You win. of all the Barry Manilow, I'm just joking. I'm a fan of Low, and but look at this shirt. Run
Yeah.
TLC, and then Big Papa G has Run DMC. Did you know that I was in a rap video?
No way. And I
And
do
I'm a
like
Manilow,
Run DMC.
Manilow. So I'm like you though. But I have to say the funniest thing, my favorite Rascal Flatts song is the same one because I feel like it allows you to go to the next step. And we are so lucky that you are with us. I've heard nothing but fantastic things.
Thank you.
We are going to have our intern at the end provide all of your contact information. Can they specifically ask for you?
Yes, ma'am, they can. Yes. And
Tell me about
because I
insurance.
am
Tell me about insurance.
insurance, we take just about any
Oh, yeah.
insurance. Our front desk receptionists are fantastic.
They are.
That they can, if you have any questions, you can give them a call and they will make sure that it is an insurance that we accept before we get you scheduled.
Beautiful waiting room. Love that you have two of them.
Mhm.
Gorgeous. I mean, the whole place is absolutely just well done with. And I know Dr. Midkiff was big on design at the beginning when they moved, and oh, it's just
Mhm.
wonderful. I can't say enough. And thank you guys for being a chamber member. And I know that you haven't been very involved, but we're going to get you as a speaker at a couple of our events because I really, and we're going to fill it with women who just have questions and
I
are
would
not
love
embarrassed,
that.
maybe embarrassed in other situations to ask, but I'll work with you. But just want to say, Drinking with Dawn, it's been a true pleasure with you. Thank you so much for your time today. I know you're very busy. And on behalf of the Troy Maryville St. Jacob Marine Chamber of Commerce, we'd like to say to everyone, have a great day, and we'll have the information to be able to contact you at the end of this.
Thank you.
Great job today, by the way.
Thanks. I appreciate that.
Thank you. Have a good day.
Okay, thank you.
Bye.
Bye-bye.